Well, we had a great last week, and the most important thing that I wanted to mention to everyone was the two experts that we brought in for both the Medicaid Reform Council and also for the Healthcare Task Force. For the Medicaid Reform Council, we had Dr. Jeffrey Brenner. Dr. Brenner is a nationally known expert on helping superutilizers, those who are falling through the cracks of our system and not getting good service with standard Medicaid and the Medicaid practices that we have in a lot of states. And Dr. Brenner has really initiated a team approach so that these folks who are falling through the cracks, who are coming to the emergency department, to the hospitals disproportionately more than the typical person, he's demonstrated that the team approach that he's initiated really helps them. It helps solve a lot of the questions that they have and a lot of the problems they have with the system. And so for our Medicaid Reform Council, Dr. Brenner was able to give a presentation via a webinar talking about the data that he has and how his team approach really positively affects the people who are in this superutilizer category. So that was a very positive experience, and after his presentation we opened it up, and the Medicaid Reform Council had a time to really interact and dialogue about the different points that Dr. Brenner made and how that might affect the care of the people we have here in Arkansas. The second expert that we had that I thought was really fantastic was Dr. Lanhee Chen. And Dr. Chen is out of Stanford. He is a fellow at the Hoover Institution. He's the former chief policy advisor to Mitt Romney during the 2012 presidential campaign, and he's a scholar in health policy issues. So we brought Dr. Chen in to talk about the 1332 waivers, sort of lay it out and answer questions for the task force as far as the possibilities with the 1332 waivers and how they might impact the plan of our state going forward. So all in all, last week was a really fantastic experience. Had a lot of good discussion about possible reform efforts in our state, and we look forward to seeing what both the task force and also the Medicaid Reform Council have in store for us in the next week or two. So we're very optimistic about it.